My name is Justina, and I'm doing my presentation on the quantification of neighborhood-level social determinants of health in the continental United States. So, how do social determinants of health vary across multiple dimensions of geographic space? The finding in this cross-sectional study of 71,901 census tracts with approximately 312 million people across the United States. Social determinants of health measures were reduced to 4 incidents: advantage, isolation, opportunity, and mixed immigrant cohesions, accessibility, and were clustered into 7 neighborhoods that include an extreme poverty group as well. Social determinants of health incidents were associated with premature mortality rates in Chicago, Illinois. An association between the social and neighborhood characteristics and health outcomes has been reported but remains poorly understood owing to complex factors that vary across geographic space. In this specific study, the use of geospatial approaches to measure the social determinants of health rather than use of singular index. However, it may be better to capture the complexity and spatial underlying these determinants. Social determinants of health indicators are mapped into different spheres, as you can see the picture on the screen of the sociological model. Components include indicators for each index. The blue shading indicates socioeconomic advantage index. The purple shading indicates the limited mobility index. Red shading indicates the urban core. And the yellow shading indicates mixed immigrant cohesion and accessibility index. In this cross-sectional study, census tracts from the U.S. Bureau from 2014 were used to develop multidimensional SDOH indices as a regional typology of the continental United States at a small area level using dimensions, reductions, and clustering machines learning techniques. The SDOH indices were used to estimate age adjustment mortality rates in Chicago with this fatal regression for the same period. While controlling for violent crime, 15 variables measured as a 5-year mean. They were selected to characterize the SDOH as small area variations for demographic characteristics of vulnerable groups, economic status, social neighborhood characteristics, housing and transportation availability at the tract level. The COH data matrix was used to 4 incidents reflecting advantage, isolation, opportunity, and mixed immigrant cohesion and accessibility. The association between the SDOH indices and premature mortality, which is defined as death before age of 75 years in Chicago, was measured by years of potential life loss and aggregated to a 5-year mean. The data analysis were conducted between July 1st of 2018 and August 30th of 2019. The data classification corresponds to social determinants with brown shades, as you can see in the picture, indicates deviation below the mean, and the blue shades indicate deviation above the mean. So as you can see, as the time went on in the pictures, the brown came in more, so it was below the mean. Picture 1 indicates the first primary component, the second picture is the second primary, third is the third, and the fourth is obviously the fourth. So in the results, among the 71,000, almost 72,000 census tracts examined across the United States, a median percentage of 27.2% of residents had minority status, 12 had disabilities, 22 were 18 years and younger, and 13.6 were 65 years and older. Among the 789 census tracts examined in Chicago, a median of 80% of residents had minority status, 10 had disabilities, 23 were 18 years younger, and 9.5 were 65 years and older. 4 incidences accounted for the 71% of all census tracts in the United States, and the SDOH neighborhood typology of extreme poverty, which is of the greatest concern to healthcare practitioners and policy advocates nowadays, comprised only 9.6% of all census tracts across the continental United States that characterize small areas of known public health crisis. So in conclusion, the modeling of the SDOH as incidents rather than as singular may be better capture the complexity and underlying social determinants of health issues. During a time of increased attention to the SDOH, this analysis may provide actionable information for key stakeholders with respect to focus on interventions that we could be able to figure out. And that is all.